When you hit record, it's recording.
Voice recording.
Okay. Press record. Hit it again.
Here is the candle for best cake.
It's a funny thing watching old home movies.
Yes, the candle. Hey, I got it.
It's like peeking in a window on someone else's memories.
Can't handle it.
Now Tommy's got the right idea for cutting the cake here.
I tell you what, I killed a lot of roaches with that knife.
Birthdays past, special occasions, or even the ordinary.
Happy birthday! Happy birthday!
You can see time passing and fast forward, like you're getting a glimpse of someone else's recurring dreams. Or nightmares.
Happy birthday to you, and many more.
Washington was hit so hard.
We had fair enough warning.
They had enough advance notice.
We thought it was a nice facility. I mean, I think they're just so overwhelmed.
So these people don't have to be dying in these numbers.
No, I mean, this is preventable.
There was a gross neglect.
This is Daddy and me.
Thomas Zenko loved to cook.
Stuffing. He put everything in it. He puts shrimp, oysters, artichokes, everything. He just kind of put everything but the kitchen sink.
He was a butcher, a restaurant owner, and ended his working years in the construction business. The diabetes, Parkinson's disease, and 2 strokes ravaged his body, leading his daughters to put him in Forest Manor Nursing Home in Covington in 2013.
It's been a battle. It's been a battle to keep him safe and healthy.
In a sadistic irony, in his final years, a simple meal could prove fatal for the one-time chef. Zenko was what's called a silent aspirator. If he wasn't positioned properly when he ate, the food could sink into his lungs, giving him pneumonia.
Every single time the doctor would say, I really just don't think he's going to make it next time. He really got through this by the skin of his teeth.
So they put cameras in his room at Forest Manor. They're now giving us a window on one of the deadliest nursing home outbreaks of COVID-19 in Louisiana.
I initially found out on the Forest Manor Facebook page. A couple of the residents, their family members had posted that they had died. And I was like, what? I'm like, Forest Manor should have told me something.
The first resident died of COVID-19 at Forest Manor on April 5th, according to data from the St. Tammany Parish Coroner. Like a silent tidal wave, COVID washed over the nursing home with deadly force. Over the next 2 months, the infection killed mothers, fathers, grandmothers, grandfathers, brothers, sisters, 38 people so far. We wanted to know, how exactly did it spread so fast?
I think early on, the nursing homes weren't really prepared for such an aggressive pandemic.
I asked the coroner, Dr. Charles Preston, about it back in June, when nursing home residents accounted for more than half of the parish's COVID-19 deaths. He noted how vulnerable the population is to begin with. And
why do you think that this is going through these nursing homes like wildfire up there?
While the patient population is closed, the staff population is not. And so the staff comes and goes and comes and goes. So, again, they could be negative on Monday, go to Walmart on Tuesday and become infected and shed virus for 5 days and not even know it.
In late March, Zenko's daughters started snapping pictures of staffers in their dad's room. March 22nd, no mask. April 2nd, April 3rd, the cameras showed 2 aides moving Zenko with no masks on. They say they brought it to the attention of a staff social worker.
I just thought that they should have masks at this point. I could see it more like beginning of March. But now that we're in April, they should have masks on.
It was after Forest Manor had been declared a coronavirus cluster by the Louisiana Department of Health on March 31st, meaning Forest Manor already had more than 2 confirmed coronavirus cases. And days later, nurses and aides still weren't even wearing basic surgical masks. While the general public wasn't masking up at that time, healthcare workers were. 2 other Forest Manor families we spoke with raised similar concerns about it.
We would lose maybe in a few days in a week, we would lose 3, 4 people, and then we lost count. Like, they come in threes, but we can't even count anymore. What are we up to, like 18, 19?
A former nurse at Forest Manor who asked not to be identified says in those early days they isolated positive patients to their rooms. Many of them were on the 500 hall.
At the beginning, they didn't even put up a wall to say, COVID patients are going here. They just started throwing everybody into 500 without moving the people who were not COVID positive. Now we're spreading it and potentially getting everybody sick.
The nurse ended up being laid off in recent months as Forest Manor's patient population dropped. She says testing was a big problem like in most American nursing homes. Only symptomatic residents were either taken to an urgent care clinic or the hospital to get tested, or they were never tested at all.
This is him.
At times in those final days in late March when Patrick Youngblood started to decline, his sister Liz Koenig says he had a low-grade fever, but that it wasn't unusual for his condition, complications from cancer treatment years before. He was never tested for COVID, but the longtime City Park Rose Gardener lived in the 500 hall, the stretch of rooms that would become the COVID wing.
When we were visiting outside of his window over that weekend prior to his passing, his roommate was in the room. People were coming in. The nurses were coming in to check. They opened the window. I was able to visit with him, and his roommate was there, and he was perfectly healthy. He was not wearing a mask either.
Did that set off any alarms in your head? I mean, now looking
at
back.
At that time, I was so focused on my brother that it didn't strike me as odd. But looking back, I would have thought that perhaps every patient should have been wearing a mask.
Despite the governor's ban on in-person visits, Liz was allowed to visit her brother the day before he died.
So you were there on April 8th?
I was.
And no full PPE, just a mask like I'm wearing right now?
Mask, just like you're wearing.
She says she's grateful to Forest Manor for that time with her brother and for the care he received. The CDC and the Louisiana Department of Health did not require testing of all residents and staff until months into the pandemic.
By the time they did start testing in all facilities, everybody already had it.
I don't know who these people are. In fact, the 2 CNAs that I saw without the masks, I had never seen them before. Oh, we're having to pull CNAs from other halls.
I wish that when it first started, that more precautions were taken. I wish that we were not allowing the staff to go back and forth from the hall. That if you worked the COVID hall, you stayed down that hall. You did not come off of that hall.
By April, Zenko was spending time out in the hall.
Somebody has to watch him because he has a tendency to choke on his food. Somebody has to be there in case he starts choking.
This picture is blurry, but it shows Zenko in his wheelchair in the hall. Look closely and you'll see his tray of food there. Staffers had to watch him eat. Before the pandemic, he would be taken to the dining hall. Then, aides started watching him eat in his room. But in March, they started wheeling him into the hall, possibly exposing him to coronavirus patients. Zenko's daughter says this was April 3rd.
Him being in the hall, he was a sitting duck.
We did have a few that had gotten COVID on that hall. We had about maybe half of those residents pass away that had gotten it down that hall.
The nurse says Forest Manor added hand sanitizing stations, and staff did use gowns, masks, and PPE when working with COVID patients. She says they had a good supply of PPE in the beginning, something echoed by the administrator in emails to families. When they ran out of gowns, the nurse says Forest Manor sewed arms onto hospital gowns for protection that the staff put on and off when entering and leaving the COVID hall.
We could have done so much more. That was hard.
There could have been more that was done to protect these residents, to protect our dad, and it wasn't. In a lot of ways, I find that it was negligent. It's sad and it's senseless.
Experts urge states like Louisiana to send health officials into nursing homes early on to help with infection control.
The states should have put the state inspectors into these homes that have the virus and have them there all of the time during the day to make sure that they have enough staff, they have enough PPE, and they're practicing safe practices. So a lot of states have not done that.
Louisiana health officials say they worked with the CDC to do a virtual infection control assessment with Forest Manor on March 15th, a pioneering program that was later used in other states. LDH strike teams physically went into the home May 15th after the critically short supply of PPE rebounded. That was after the virus had killed 32 residents there. No one from LDH would do an on-camera interview for this story.
Would it have made a difference if those agencies like the CDC and the state had come in earlier?
Absolutely.
The state needs to be more forceful. There needs to be more enforcement, more accountability, and families should be questioning why these nursing homes still have licenses.
There were many sleepless nights where he wasn't sleeping at all.
And he'd start calling you, and then he'd start calling me, and he'd stay up all night. So he had something on his mind.
Zenko's fears became a reality 2 weeks before state inspectors went into Forest Manor.
I'm the daughter of Thomas Zenko, and I was trying to see if I could get him on the phone.
He went to the hospital for a fever and a suspected urinary tract infection.
He's not going to be able to use it himself, but I wanted to see if I could talk to him.
Remember, throughout the ordeal, family members, Zenko's daughters, were all locked out.
I don't know if he's awake in there.
Oh, I know he was sleeping on and off, right?
Both at the nursing home and essentially at the hospital.
One moment.
I'm at a loss. I'm home. I'm trying to, to get information from people, and I'm leaving messages. Nobody's telling me anything.
These are their recordings from Zenko's time during his final days at Lakeview Hospital.
Hey, Daddy!
Hey there.